Alright, so here we have Artie. He is a middle to late teens Appaloosa gelding, or POA. We're not sure. He did come from auction, so history is a little bit unknown. He is being seen today for some facial paralysis. Find me here. Some facial paralysis. So you'll notice, again, we don't know what happened, but he does have a scar on his nose. He did have raw spots behind his ears, so we're not sure if he had a halter that he had on for too long and set back or what. But he does have there on his right side where things are a little too relaxed. And it's causing some problems. We're going to straighten him out here. Now, it's going to make it a little bit difficult because I do need to work on right around his eye. Cleaned up there. So, in lieu of a fly mask, I do have a surgical towel doubled over to act as kind of our blinding or light blocking agent. I have that kind of go the long way with it, and then we will get started. Alright, and what I will be using today is the Clinic PBM laser little pen. It has the red, which is 630 to 660 nanometers, and the near infrared, which is 850 to 940 nanometers. So we will be using that today, and I will be focusing on the acupuncture points for the facial paralysis, which includes the ST1, which is right up here along the eye. We're going to do the ST2, and then we are also going to be doing the ST4, which is right up in here, just to help him. And we'll do that bilaterally, just because we aren't sure where the origin is. We just know what's affected and what's overcompensating. So we will be doing that. Sorry, there is a pig in the background. Boy, Artie, you're okay. But I do have my hand on the other side to help with kind of holding that towel. So we will get started. We will do on red and infrared. So we'll start down here at the ST4. Oh, Artie. Move up here to the ST2. There, he's licking and chewing. Move up to the ST3, and he does have eyes closed. Oh, bud. Ooh. Hey, hey, hey. he thinks it's a little bit of feeding time here. I'm going to readjust here. I'm going to kick this back on. Oh. Sorry about that. I did have to replace the battery here. We'll go ahead, put our blindfold back on. Okay. And there we go. Now we're going to go ahead and do ST6, which is going to be right up here. Artie. Okay. Then we're going to do ST7. This is where we're going to come up here. Okay. Okay, then I'm going to do ST9, which is right back here. And I'm also going to do, and it did just beep, so it does need a little bit off. Okay, and we are going to do S1, which is going to be right up in here. And that's more for nerve stimulation, because it does kind of come down that branch of the face. And then I'm also going to do GV26. But he does chew, he does pick up food, swallow. So there is some function. He just has the droop lip, a little bit of a droopy corner of his eye. Vets can't figure out what's wrong, but they did clear him for laser protocol to see if that would help. So we are trying that. But they are not concerned since he does have a blink reflex. Move down here to 26. Alright, Artie. Good boy. Good boy. Good boy, Artie. Good boy. Give you a second. Okay. Make sure it's off. Okay. And we're going to do the same thing to this side, making sure we're kind of covered and tucking the eye a bit. Okay. So we're going to start over here with the ST1. We do have some kind of nerve twitching there in his nose on this side. The other side was pretty quiet, but that's to be expected with the damage done. Then we're going to move up here and do the ST2. We're going to move up here to ST4. Good boy, Artie. You're okay. You're okay. I always do like to reassure them that I'm over here, just because I am kind of popping in and out as they're moving about. They're touching me in different places. So proprioception's not quite there. Especially with him, he does have some vision issues, but again, the vet cleared him to be treated. He does not have any tumors or any abnormal spots in the tissue or dermal layers for him to be concerned about any sort of photosensitivity or tumors or anything like that. And I did make sure to speak with the vet on what we were doing to kind of coincide with him. We'll move up to 6, which is going to be right up here. I'm going to go on the back side of the halter here. Artie, good boy. Artie. Take the towel off and reset the feet here. Okay. Gonna go towel back on. Just have a couple more spots, Artie. Okay, and I'm going to move up here and do 7. There is quite a bit of sighing, licking and chewing. Okay. Here. to move on to 9. So 9. We'll be right back in here. Right in my ear. Boy, Artie. Nerve twitching, some little bit deeper breathing. Oh boy. Now we're going to move back up here to DV26. I'm going to do that one again on this side. Make sure this eye is covered thoroughly. You're okay, Artie. No. There, I felt a little bit of a jawing notion. Deeper breathing. He's got a little bit of a head quiver now, which he didn't have prior to treatment. And he is getting K-taping and PEMF in addition to red light and this acupressure treatment. So, and we are doing him about twice a week, every week. Kind of a day-by-day basis with him. I do coordinate with the owner to see if there's any changes, to be able to change up his regimen a little bit. But otherwise, we don't want to overwhelm his system because he has gotten used to eating this way and functioning. So I don't know how old this is. Alright. And that is going to conclude our treatment. I know, I did want to get that out of your eye. Boy. This is going to conclude our treatment for the laser light and acupuncture treatment. But as you can see, he does have some control. Definitely droop lip on that side, but he does have full gesticulation, control over the upper lip. So it seems to be all lower, and the facial nerves that branch off down the side and underneath the jaw. So we are slowly working on those with the red light pads wrapped up kind of underneath, and then also up the side of the jaw as well, kind of up into here. Just trying to make sure we cover all of our bases because, again, we don't know the extent, we don't know what happened. We just know he ended up at auction to eventually land in a great spot. So, thank you.